Good morning, Mary Ostien here with Hooked on Hope. Here with Shawn Hall in his beautiful store, Helios Medical, on Dale Mabry here in Tampa. Shawn, thank you so much for filming with us today on when your store's closed so that we could film this and so that we could practice social distancing. Thank you so much, and thank you for your time today.
My pleasure.
Good to have you.
Thank you.
Shawn, as you know, or back in early 2020, you were recommended to Hooked on Hope, and we approached you to discuss a possible partnership to provide our breast cancer patients throughout all of Tampa Bay with lymphedema products for those women who suffer from the debilitating condition known as lymphedema. And Hooked on Hope, we had been funding lymphedema garments for a couple of years prior, and we really decided that the need was ever present in the community, and that we felt that it was very important to identify a local vendor and a local brick and mortar so that we could keep our business locally in the Tampa Bay communities. And you came highly recommended by one of the healthcare organizations Hooked on Hope partners within the community. And as you know, I contacted you and we met back early in the year prior to COVID, in fact. And since then, we quickly developed a partnership between Hooked on Hope and Helios, and we're just very grateful for the partnership.
Excellent. It's been a fantastic partnership. I've really enjoyed partnering with you. As you stated, our goal is to provide breast cancer survivors with lymphatic garments. What we want to do here, like you said, is provide a local solution to where not only can we help properly measure and fit the patients, we can also give them education of their garments to help them in their process of healing.
That's awesome. It's really just been amazing so far. And Shawn, as you and I have discussed many times, and it's very important for the Hooked on Hope and the Tampa Bay communities to understand, is through your knowledge and Hooked on Hope's research, we were stunned to learn that even women that have health insurance or even Medicare coverage that will pay for them to get their breast cancer treatment and will pay for them to have their lymphedema therapy sessions, but will not pay for them to purchase a garment that they will need, if I'm not mistaken, really to wear for the rest of their lives. And so with that knowledge, Hooked on Hope about 3 years ago decided to dedicate several $1,000s a year to purchase lymphedema garments for the not only the uninsured but the underinsured. And I know, tell us about your experience, Shawn, in the community with regard to the lack of proper coverage.
Absolutely. That, in my opinion, is one of the greatest shortfalls of the insurance industry, is that, as you stated, therapy is covered, lymphatic pumps are covered, but the garments that can be used for both prevention and healing are not covered through public insurance, being Medicare and Medicaid. So one of my goals is to help patients navigate these insurance processes, whether it's public insurance or private insurance, to help maximize their benefits in acquiring their garments.
What an amazing service to the community. It's not only a service to the breast cancer patients throughout Tampa Bay, but it's also an amazing service to Hooked on Hope. All we have to do is, because I want you to tell us about that here in a moment, all of the many therapists from the lymphedema programs throughout all of Tampa Bay, they simply have to contact you because you're in a trusted partnership with Hooked on Hope.
Right.
And then send you the request or the demographics to fill that order for the patient. I'd like you to tell us about that a little bit. It's just been really an incredible time-saving endeavor to more quickly connect the funding from Hooked on Hope to the patients that really need these garments, and they need them in a timely fashion.
Right. So as you stated, what we want to do is make the process as simple as possible for both patient and therapist. As you stated, all I need from the therapist is a demographic sheet, which is going to include their contact information as well as their insurance information. From there, I am able to run their summary of benefits and then help work with both therapist and patient on the best way to acquire their garment, whether it's through Hooked on Hope, or whether it's through an insurance payment with themselves.
And one thing it's important for the community to know is obviously if a woman is uninsured or has insurance that just simply does not cover any lymphedema garments, that Hooked on Hope will pay for 100% of that garment for them. And not only just one garment, because I believe, Shawn, you could verify this, most women benefit from at least 2 garments. We live in a hot environment. They need one to wash, one to wear, or even the gloves and the gauntlets that get very warm. So we do try to purchase 2 if we can. But how often do lymphedema patients really need to replace those garments? Is it annually or semi-annually?
So the recommendation is to replace every 6 months.
Okay.
Most manufacturers will have that as the recommendation, that it's 1 sleeve and 1 glove.
Okay, so for patients, they benefit.
Right. So what you want to do is it's kind of changed a little bit because it used to be 2 sleeves. Okay. Now it's going to be 1 sleeve and a glove.
So to clarify,
Right.
Most lymphedema patients, the standard lymphedema patient, really does require the arm sleeve, the compression sleeve, as
Right.
well as the glove,
That is
the
correct.
compression glove. And does that make for a more complete fitting for the treatment of the lymphedema?
It does.
Okay.
So what we want to do is we want to be able to move lymphatic fluid all the way from the most distal part into the trunk.
Fantastic.
So we need to make sure that we have either a gauntlet or a glove on the hand to prevent swelling in the hand and to help with effective movement of the fluid.
And I think one of the important messages for the Tampa Bay communities is that we never want a woman to go for a year or several years thinking that that first garment that they have is the only one they should ever own. We will be more than happy to, again, replace or purchase
Right.
1 or 2 a year for the patients. Shawn, does it matter does the patient have to come into the store to get measured and pick up their garment? What is the process of the patients getting the garment once they get pre-approved from
Absolutely.
Hooked on Hope?
It's actually one of the things that we also wanted to bring to the equation here is that we have the ability to either have people come into our store here to be measured at the store, to also be fit here with product at the store, or we can work with your therapist and have the product shipped directly to you so you do not have to come to the store. So both mail options and then also pick up at the store
That's
options.
fantastic, because some of our patients do not have transportation. They do rely on public transportation, so that's an excellent benefit. So, Shawn, can patients order and receive both off-the-shelf, ready-to-wear garments as well as get fitted for a custom fit here in your store?
They can, yes. One of the things you'll see is that not all patients will fit into a ready-to-wear garment, so we do provide the measuring for custom garments here at the store.
Fantastic, fantastic. I really appreciate that so much. And also, I know that you had mentioned that for any patients in the Tampa Bay community who are suffering from lymphedema, who may not currently be receiving therapy or may not currently have a garment, I believe that you said that they are welcome to call or stop in the store, and that you will help connect them with Hooked on Hope, but you will also help connect them with a qualified lymphedema therapist in the Tampa Bay communities.
That is correct. We have several different locations of lymphedema therapists here in the Bay Area on both the Hillsborough side and the Pinellas side that can definitely connect.
Fantastic. Shawn, I want to thank you for your time today, for opening up your beautiful store to us, and for our partnership. We're really looking forward to continuing that partnership into 2021 and beyond. So thank you so much for your time today.
It's a pleasure. Thank you.
Thank you.